Thank you so much. Dr. Anil, psychiatry as conditions, as comorbidities, how common or uncommon it is?
It's not uncommon. That is what I can say. Of course, it depends on many factors, but psychiatric problems are very much there, and many times it happens that they result in overeating and obesity also.
Yeah.
So psychiatric evaluation is very important.
Sure. Thank you. So coming on to that obesity, we see there is so much popularity with new drugs and approaches coming for obesity management. How do you see the whole landscape of obesity and type 2 diabetes, changing with these new interventions that are coming in?
I think now wonderful drugs are available. So obesity is a problem of plenty actually. So now since adolescent onward, we are seeing obesity, and obesity itself is a big factor in producing type 2 diabetes. So with the advent of semaglutide and tirzepatide and other GLP and GLP combinations, it can be managed very easily. But of course, in spite of the drugs, first and foremost, we have to make sure that patient should stick to the diet, exercise and lifestyle modification. Sure. Without these, drugs will act for a very small period of time, and once they stop drug, because they cannot take it lifelong, even with the best of the molecule, studies are up to 5-6 years only. So beyond that, you cannot take that. So lifestyle modification, that will go a long way in managing your weight and everything. So my first and foremost thing will be that you have to have a healthy lifestyle, proper diet, proper sleep, exercise, and goal also. But of course, I will never overwhelm them. Yeah. This is your goal. In a small frequent way, that you reduce your half kg over a period of 3 months, 1 month, depending on your how much motivated you are.
Sure. Thank you very much. Jitendra bhai, the audience is young, and technology is coming up big time. Diabetes is also not untouched by technology. How do you suggest what technologies one can rely on in managing diabetes patients and or comorbidities? I would say technology and or tools.
A lot of smart app is available, so that can keep the patients connected with their treating diabetologists. Lots of now CGMS devices is available in present era, so you should teach your patients. With that, you can easily monitor their blood sugar, particularly those patients having very volatile or fluctuating glycemic variations. In that, we recommend CGMS, Libre Pro, and what the devices are available. Smart pens and everything is available. Now patients are very techno savvy, so if you give some time to the patients, that makes management of diabetes is very easy.
Thank you. So a lot of options are available, and of course the CGM control is has totally transformed it, and one can rely on that to look at how the glucose is being controlled. Before we close, let us go back to the similar format, and I would ask you a question. What's your golden rule for a diabetic patient with everything in one line? We start with Dr. Solanki. Golden rule for diabetic.
Golden rule is to control the sugars, first of all, because if you control the sugar in current times, then and then only you will have impact on the HbA1c, which is a story almost 100 days plus. So first and foremost is to keep the sugar under control with all available medications according to the patient's profile. And also, if the patient is having some current triggers, as if it is to the case which I told, then probably person is admitted with an acute community acquired pneumonia, then one should treat the pneumonia first, along with keeping the sugar under control. And we know whenever patient is having any illness or admitted in ICU or HDU, the standard of care is always insulin. Yeah. And after the patient comes out, again patient will be switched back to the medications according to the patient's profile. So the sugar control in current times depends on the patient's sugar values which were on admission. You can monitor the sugar every 4 hourly, 6 hourly. But I think if the affordability permit and accessibility permit, then CGM would be the best probably will prove best in that setting, because for a complete 5 or 7 days profile of sugar can be checked without causing the pricks to the patient, and which would be also very inconvenient to the patient.
Sure.
I would like to give one line.
Maybe you
answer.
give one line and you conclude it so that we save time.
That's what we need. I would like to say in one line that keep your sugar steady, feet protected, mind calm, and disciplined lifestyle. Treat the person, not the sugar.
Treat the person, not the sugar. With that, thank you very much. Thank you, esteemed panelists. It was a pleasure being here. And back to the chairpersons.
Thank you, sir. It was very an excellent discussion we had. And yes, it is best session of the this conference.
Thank you.
Thank you, Santosh.
Thank you so much.
Thank you. Wonderfully done. Thank you so much. Thank you all. Yes, please, a group photo. Thank you, Santosh sir, Jitendra sir, Bhagirath sir, Chintan sir, Anil sir. Thank you to our chairpersons. I'll be there.
Yes, sir.
So before we start our next symposium, let's have a round of applause for all our panelists up till now, for all our chairpersons up till now, for our audiences up till now. Thank you so much. Thank you. I request all the black t-shirt people to quickly come onto the stage for one quick picture. In the next 1 minute, Rutul, please don't go out. Vikranti, Mahira, Smita ma'am, Banshi sir, Vidisha, Neerav, yes.